we are going to do chapter 13, career tracks. Here we go. All right, there's the book. And we are going to go down to our last unit, Beyond the Basics, and look at chapter 13. The intention of this chapter is to help you make decisions about where you want to start your career and then where you might want to progress with it. Generally, as far as the NBLEX is concerned, you might find some questions related to this content. This is not a memorization chapter, and it's not necessarily an application chapter. It is about where massage is practiced and what are the specifics around that. So we're going to look at the spa. We're going to spend most of the chapter time here in the spa setting and how that is quickly moving towards health and wellness centers. And then looking at the medical care environment and what is important about how we adapt our behavior and our approaches there, and then the sport and fitness world. So that is these are the main employment categories, main career categories, and we will explore them enough so that you can begin the process of making a decision on where you want to start. And I would suggest that you start here with therapeutic massage in the Health and Wellness Center. These a wellness center, spa franchise, or solo practice targeting the general outcomes using the scope of practice and the skill set within this textbook. And then potentially there would need to be a little bit more experience and education, not methodologies so much, but the uniqueness of some of these environments and the people that they serve. People in the medical care environment are usually a little bit more fragile. They're undergoing multiple types of treatment. And then in the sport and fitness arena, you got physical performance as something that has to be considered. All right. Terms, the objectives, and kind of the overlap. So, some more information about the uniquenesses as well as the integration of these various environments. And then always a focus on professionalism here. This is a good one. They're all good. So this is the biggest category of career development, and the area where the income and your ability to generate resources and finances is most consistent. So you want to know about this. And this is going to give you an overview of the types of spas, the history of the spa. The spa is a healing environment. It's a very interesting historical context of originally how it included healing of the waters. So I talked in the previous chapters about the importance of hydrotherapy. The wellness environment uses, the environment is an important part. The ambiance is an important part of the total experience of being in a Health and Wellness Center. So this talks about that. And then this evolution of the spa environment, which historically was an integrative health and wellness environment, kind of got pulled off into more of a luxury idea and is now coming back to its roots as an interdisciplinary care environment, and kind of evolving to work with chronic care, whole body chronic care conditions. So it's important to understand what a franchise is. We've talked about this before, what they are not, and this is the biggest employment sector. I think, my opinion is that it is an excellent place to begin your career, and you can have a longevity, a long career within this type of an environment, and really, really perfect your massage therapy skills without having to also be the employer and have all the business skills. That's not for everybody. It is for some, but the franchise environment is evolving. They're nimble, and I am supportive of it. You can get similar things in a well-run multidisciplinary wellness clinic as well. And that's what we have at the school, Health Enrichment Center Wellness Spa. So here is, the overview of massage within that environment. And lots of times you're going to have an overlap with skincare. And this gives you a little bit of idea of what that may look like. And again, probably not tested on the MBLEX, although the general spa environment may show up in a question, as well as the franchise. So the franchise is really morphing into this idea of a wellness integrated center. So again, here are some of the products, probably not tested, but good to know, especially if you're working in conjunction with an esthetician, which is very common in this environment. So this just gives you a little bit of a visual of a day at a spa, gives you an idea of the integration of hydrotherapy and adjuncts and add-ons, and that's common in that environment. And then we go into the pay scale. You would want to refer back to chapter 3, which talks about businesses and finances, and compare and contrast this information. And as of the publication of this, which was 2004, copyrights 2005, formally written in 2003, these were the figures at that time. And as we talked before, massage therapists tend not to work full time. And so 3/4 time or half time. But down here, if we look at this, if you're making about $20,000 just for math purposes at half time, that would relate here to the $35,000 or $40,000 if you doubled that, which would be full time. And then cross-training recommendations, and one of the very best is esthetician or cosmetology. And I am supportive of cross-training. So cross-training as an esthetician massage therapist works very well in this kind of an environment. Also, cross-training and some of your movement ideas, such as yoga, again, works very well in this environment. The spa environment's complicated. It's where a lot of cross-cultural interventions are also combined. There could be an acupuncturist, there could be a yoga therapist, there could be somebody who is therapeutically trained in essential oils. You could have somebody that teaches meditation. You could have in this world, it could be a medical spa where you have cosmetic procedures performed by medical professionals. Uh, it can be a pain clinic type of environment, focusing on whole person care. So a very rich environment in the spa world. The medical care environment is not as overarching as the wellness center spa franchise arena. It's a very narrow focus. And there's a lot of confusion about medical massage, which really doesn't exist. There is massage in a medical environment. Therapeutic interventions used either autonomously if it's appropriate and within scope, or as part of a supportive team with other health professionals such as physical therapists and chiropractors and pain medicine specialists and so forth. That is not medical massage, that's therapeutic massage in a medical environment. So not a lot of autonomy here. You are an employee, except in chiropractic. It can get a little weird in chiropractic. That's kind of a crossover between a wellness environment and a medical environment. Insurance is taken often in a chiropractic environment, but the practice is not necessarily acute care and have that kind of a medical orientation. So this environment, the Veterans Administration, whole person care, the structure they have around that within a hospital-based or a medical-based setting is a good platform for understanding what massage would be like in this type of an environment. This is not autonomous practice. You need to be part of a team and know your space and place in that team. So the ongoing education is about the environment and the other professionals and treatments that you are going to have to understand in order to practice massage safely. And primarily, unless you're in a rehabilitative setting and possibly chiropractic, like rehab for physical therapy, the massage is going to be palliative and possibly some crossover into stress management. And the medical settings are focusing, hospitals, et cetera, are focusing on acute care. So now there is that overlap of, I mentioned the VA, but pain clinics, pain medicine specialists are looking at a more biopsychosocial system, and you can start to see a little bit of overlap there into the wellness center. So big deal. You got to be part of a medical care team if you're in this environment. Your professionalism is very important. How you present yourself in that environment. There are rules and regulations and increased safety and sanitation standards. And you've got to have an increasing understanding of these points: infection control, sanitation procedures, and you need to understand what other people are saying. Whatever charting and documentation you would need, you'll probably have to have special training provided by the environment. So there is an important role for massage therapy as part of this team. And this box here talks about what that would look like. Communication is essential, and communicating concisely, working with the idea of consultation and following guidelines. So here is another box that talks about clinical massage in a health/medical setting. And this is the actual VA system platform and how it is used and integrated. Excellent model for massage in this environment and how this environment would integrate massage. Okay. The biggest hurdle right now is in integrating massage therapy into a conventional insurance-based medical setting is pay, billing the insurances and having the insurances reimburse. So it's not that these environments don't realize, and the professionals that work in these environments don't realize the benefit of massage. It is how is the organization going to bill and collect the money? And typically you would be an employee in this setting. This is where you would have to be aware of HIPAA procedures and be in compliance. You need to have an increased understanding of the structure around health insurance reimbursement, and then how you would actually integrate into a medical care setting, or how you would explain how you could offer massage in that setting. You also are going to have an increased awareness of medications and basic pharmacology. There will be a bigger mini pharmacology kind of document on the Evolve site for you. Medline Plus is actually excellent for looking up medications, and you would want to know, you'd have to figure out critical thinking. You'd have to figure out how massage would influence the action of the medication and vice versa. So this gives you a little bit of overview about that. And then here are your key points. And you will be tested on general categories of medications. So that is, it's helpful to be able to connect with that. And again, this Appendix C has been moved to the Evolve site. Here are the pay scales, and the interesting part of this is going to be that the various pay scales, especially as organized and other environments will follow by the VA, here is that it's going to be based on credentialing and entry-level education, and then how you progress will be involved in steps of that. So this is not a gratuity-based or tipping environment. And the truth is, you'll make more money in the health and wellness setting, which also, depending on how the business brand is portrayed to the client, is also more of a gratuity setting. So sometimes people get confused about what the actual pay structure would look like in the medical environment. The actual massage therapy is the application of methodology is basic. It is not any type of an aggressive approach at all. And then cross training, you can take a look at certified nursing assistant, possibly EMT. We've had a lot of EMTs come through the program, LPNs, and so this idea of patient care technician or certified nursing assistant, nurse's aide, this type of education tells a potential employer that you know how to function in a healthcare setting. You know what the hierarchy is. And there's also an assumption that you're not working autonomously. So there would be a supervisor that you would go to, and you would be following treatment recommendations. Okay. The final environment that we're going to talk about specifically is sport and fitness, and you may work autonomously here. And I've spent a lot of time personally in this environment as well as the others. And so there is an increase in knowledge here about working with sports related injury, and also an understanding of training protocols, individual sports, the training effect, performance demand. Those are the kinds of things where there needs to be an uptick in education and experience. Also, the opportunities in this environment are not nearly as broad as they are in the general or the wellness center setting. And this environment also, especially if you are involved with amateur or professional athletes, this is you're kind of part of the medical team. So there is some overlap with some of the things that I mentioned in relationship to working in the medical setting. You also can function autonomously with individual athletes. And if that is the case, when you don't have somebody you can go to for recommendations, then you need to be aware and careful of when you need to refer, because there is a specialization in professionals that care for athletes, specifically around the common demands and the strain on the system with performance demand. So we function initially in this environment in two areas. One is the restorative recovery, and then the other is recovery from injury. So when we're talking about recovery in general, we're talking about that there's no injury involved. It's just how does the body recover from that more intense physical activity related to the practice schedule or the competition schedule. And there is a tremendous amount of overlap as the performance demand increases. And this content here would be used both for what we call tactical athletes, which would be firefighters, police, military, as well as your performers like dancers, musicians. They use their body in a specific way, in a repetitive way. And there is a very strong body-mind connection here as well that you need to be aware of as you're working with somebody. So here are the common goals. And I've lived in this environment, so listen to me when I speak. This is not for everybody. And these individuals are good people. They are not typically entitled people. They but they have a lot of pressure. And there is a lot of physical trauma that can also manifest as emotional trauma. Because if they can't perform, then in essence, they've lost their job and their identity. So this is a complex environment, and the scheduling is crazy. And so, if you need a typical uh, weekly schedule, working with professional athletes is not going to give you that, or with competing athletes, including Olympic athletes. Now, being able to adapt to an amateur athlete, somebody who is really engaged in their own physical performance or likes to ride bike for physical activity, that sort of thing within a fitness center, you might be able to get some more regular scheduling there. Uh, so just kind of have realistic expectations here. And most athletes don't have a lot of money. So this is not necessarily the population or the outcomes that you target um, if you're looking to charge high fees or whatever. Uh, and any and all of our goals, um, relaxation, well-being, and then modification towards stress management, sleep is essential for recovery. And then pain management is big deal. And also the functional ability, but they don't necessarily, athletes and performers don't necessarily use their body in a normal function way. So that sets them up for more musculoskeletal type injury. So here are our common goals. And back in the day, when a long time ago, there was a idea that they would use sport events like marathons to bring the idea of therapeutic massage to the public. And it was a good idea, but that's where this sport event started, and you still may be tested on this on the MBLEX, the idea of what is a pre-event warm-up, post-event, recovery. You might find these words, even though this is rarely how massage in this environment is practiced. Occasionally, you'll sometimes see schools participating in an event, but not in general. If you are in an event like this, here's a sample consent form, and you really can't do much because you may only see that person one time. And so it really is only an experience of what massage can offer. It can be, there can be some promotional marketing to try to get people to use massage, increase your client base or bring people into a fitness type environment. And there's starting to be even more crossover in the wellness center spa franchise arena here. So this is all starting to come together. Here's a sample intake and consent form that you could use in those environments. You could use this in any kind of a promotional event. So you could be at a local festival or something, and setting up a chair, and you could use the same kind of a consent form here. And as part of that whole sports massage event team, public relations, they would try to put together a sports massage team. And again, you just don't see that now today, but it's here. These few sentences are here because it may still show up on the MBLEX exam. So this talks about pay scales. This is an area of self-employment. or you might have a few of your clients that are in this category as part of your general practice. Cross training is interesting here. In the professional world and with athletic trainers and the rest of the medical team, orthopedists, etc., with professional athletes, they are not as supportive of a cross train as a personal trainer. There's a whole different hierarchy under a credentialed athletic trainer, coach, strength and conditioning. But if you are in a fitness environment like a local gym or a recreational center or something like that, then personal trainer might be something that would be helpful in through here. And that's it. This all gets mixed up, but I think it's important that you understand that there are some trends. And even though there is overlap, there is uniquenesses in each one of these career categories. All right. Here's your summary. And obviously, this mentoring tip. Career focus changes as experience is gained. Sometimes massage therapists begin to feel limited or discontented by the environment in which they practice. Be aware of some self-reflection needed here, because, if you begin to dislike a practice setting, then what you might do inadvertently is begin to degrade the value of massage offered in that environment. And so that's inaccurate. What has happened is that you might have outgrown and aren't challenged by that environment any longer. And you need some variety. So instead of complaining or becoming frustrated, get some additional training, look towards some specialization and move on. That's okay. All right. And here are your multiple choice questions for discussion and review. And on your Evolve site are your graded required chapter tests. And we are tunking right along. The next chapter is going to be divided into a lot of subsections, trying to give some specific ideas and focus based on population sectors. And one of the ones we're going to look at is actually adapting massage to work with animals. And Fundamentals is the only entry-level textbook that has that. So that's an example, but we also get into the adaptation around various additional environments like long-term care and dealing with pain and pre and postnatal and mental health issues and that sort of thing. So that's our next chapter.